All right, welcome to the Nice Guy Show. I'm Coach Ari. I've got Coach Chuck and Coach Faisal with me, and I've got a really crazy topic today. Does therapy fail nice guys? And I'm a therapist saying that, and a coach, but am I shooting myself in the foot by saying, does therapy fail nice guys? Should nice guys go to therapy, or should they go to the manosphere, or find a coach? So let's start with Chuck. You're a therapist.
I
Does
am a
therapy
therapist.
does therapy fail nice guys?
Well, I think we were talking about in generalizations. Um, therapy therapy does feel nice, guys, and I'll tell you why. One is that therapy is a medical model. Okay? If you go to a therapist, your therapist has to give you a mental illness diagnosis in order to get paid from the insurance company. And the nice guy syndrome is not in the DSM, which is the manual that we basically use to look at the criteria for mental illness diagnoses. And as a result of that, oftentimes nice guys feel like well, I should go see a therapist to take care of my problem. But it's not really an illness as much as it is just a bunch of learned behaviors that have caused sort of maladaptations that aren't serving you any longer. And on the one hand, I think therapy can be helpful, but I also think that you have to be really careful and find a really good therapist because most therapists out there, aren't don't know what the nice guy syndrome is. Most therapists are coming from it from a very feminine, coming from therapy from a very feminized perspective. And part of the issue with the nice guy syndrome is that they have a highly developed feminine side and they're out of balance. They don't, and so when they go to therapy and it's coming from a very sort of nurturing, feminized type of position, they don't actually get the practice that they need, which is the more masculine energy, the more, you know, the more masculine energy that is the doing, the being, the achieving. And when I work with a nice guy in coaching, we don't talk about his past. I do that in therapy, but we don't talk about his past. We're talking about the present and we're talking about moving him forward. And I think that's something that most men need is the ability to say, sort of get present and then move forward. Now, some nice guys do have mental illnesses, and going to therapy to treat those particular illnesses can be very, very helpful. I spent, I think, 4 years with a therapist. I had a great male therapist. He really took me to some great places, and we worked on some of the mental illness things that I was struggling with. And then I needed more. And that's where I read No More Mr. Nice Guy and, started working in that area. So, yeah, I think it's something that can fail guys. And at least that's been my experience is a lot of men that I see have tried therapy and it hasn't really worked for them. And so they've ended up finding me and working with me.
Chuck,
So
Can you share some of the mental illnesses? Because I'm sure, our listeners out there will be going, what kind of mental illnesses, and when will they know to go to a therapist? Because I'm quite intrigued with this as well.
Yeah. So I think when you think of a mental illness, there's different types of illnesses, right? I mean, you can have a cold and it's an illness. You can have pancreatic cancer, you can have diabetes, right? So there's a severity in different types of illnesses. So having a mental illness isn't necessarily like, oh, you're crazy, you know. But we've all suffered from the blues, feeling a bit down. We call that depression. We've all suffered from having a little bit of fear about, having a conversation with somebody. That's anxiety. We've all maybe been a little bit of, thought there were people talking about us. We saw two people over there that we knew and wondered if they were talking about us. So that's paranoia. Maybe you've been in a crowd of people and you thought you heard somebody shout your name. That's called a hallucination. So we all have these things. It's just that when those things start to overtake your life to a point where you're having a hard time, maybe doing a good job at work, being with your family, being present in society. So it's when the symptoms of those things become so great that you're not able to function in life, that they become an illness. And an illness is a little bit different than a disease. A disease is something that the doctors cure. Okay? An illness is something that the doctors treat. So when you go to therapy, or working on illnesses, it's something that you treat the symptoms. So, for example, a cold. Okay, a cold, you take cold medicine. It doesn't get rid of your cold. It just treats the symptoms. And that's essentially what therapy does, is it helps you treat the symptoms of something that's going on in your life. And the more tools you have. So let's take depression, for example. I think a lot of men struggle with depression. That is something that you need tools to be able to work with. You need to have treatment of that. In the studies that have been shown, it's somebody with an illness, let's say depression. 50% of the people who take medication get better. 50% of the people who just do therapy get better. But if you take a combination of medication and therapy, then the increase goes to about 85%, which is why if you're suffering from a mental illness like depression, anxiety, schizophrenia, something along those lines, you need to see a psychiatrist who can assess you and help get your brain chemistry back online. So some illnesses, the smaller illness like a cold would be an adjustment disorder. That would be something like you just went through a divorce. Okay, you're readjusting. One of the things I think a lot of guys struggle with is something called dysthymia, which is a no high and low. It's just kind of like this midline. It's kind of like a low level depression with no highs, no lows, and they just kind of go through life. It's the quiet desperation kind of thing. So those would be reasons why I think therapy would be great. But if you're just working on your nice guy stuff,
Yeah, you're talking about treating symptoms.
yeah,
I think, and I think you're saying that therapy is maybe the best choice to treat symptoms if someone is in real distress.
exactly. Yeah,
But if you want personality transformation,
right.
then something like coaching might be a better option. Uh,
Exactly.
yeah, Faisal, what do you think? Does therapy fail nice guys?
I think so. My experience with therapy, receiving therapy myself, and also helping and seeing other guys as a coach. To me, therapy is like salt. You gotta have the right amount. If it's too little, then it's bland, and if it's too much, it's unconsumable. And therapy, for example, coaching is what takes you there. Therapy, sometimes you need to shed a lot of things that are holding you back. So, for example, they might be, especially for nice guys, as you mentioned, Chuck, they're more in their feminine, they're more in their emotional center. And what happens is when somebody's more in the emotional center and they go to something like coaching, it can be a little bit too hard for them. What therapy I found is it's a great place for them to start. It's a great starting place. And it's a great place for them to pace themselves, get connected, start working on it's a very soft approach. And sometimes a lot of men need, or nice guys need this because it's not very jarring to them. And what happens is when they start feeling a lot more comfortable analyzing their emotions, seeing about what's going on, being more introspective, then I think this is where they need to move away from therapy, because too much therapy, like I was reading a little bit about therapy. Therapy is very much, it was designed very much for women. and it was very feminized kind of approach to reducing our stresses in life and problems in our life. And if you have too much therapy, if a man does spend time too much talking, too much in this feminine, his cortisol level goes up. And this is why we need coaching, where coaching then starts to puts the man into action. And this is where I really benefited, because I had a coach. He was also a psychologist and a therapist, and what he did was he was able to balance between what I needed. How I started off was more therapy, then it got to more towards coaching, which was more drive, looking at where we are now, where I want to go forward. And it was very much masculine, task based, action based oriented, and that helped me to stabilize myself more. But I know guys who've been in therapy for like 20 years, and they're just stuck in this loop of just emotionally vomiting nonstop in this victim mentality. There's something wrong with me. I need to go therapy. There's a problem. I need to go in therapy. So I think therapy, if you're stuck in it, will keep you into the victim mindset.
Yeah, it's interesting because I think both of you have talked about therapy as maybe a first step, almost like an undergraduate degree, and then you move on to the coaching grad school. Um, and you brought up the point, Faisal, about some people can do therapy for 20 years, and that was literally me. I did psychoanalysis. I started when I was 11,
Wow.
and because I was a depressed kid, and then I stayed in it, and throughout my teenage years and my college years into grad school, and it was hard to imagine stopping it. That I was telling Chuck earlier, there's like an inertia that can come with therapy. It can be extremely open-ended. And even, especially for people who do psychoanalysis, there is this idea about being a lifer, and,
Mm-hmm.
and it's almost joked about, but I think there's some problematic things about it, because it's not teaching people to be independent. It's not teaching people
Mm.
the skills. I'm generalizing, obviously, but the skills to be their own therapist, or as Chuck said, to you know he tells his clients, I want to put myself out of business. Um,
Yeah. I'm trying to work my way out of a job here. That my goal with everybody when they come in to see me for therapy, and it's the same thing. I'll use this with coaching as well, but my job is to work myself out of a job. I don't want you here forever. I want you to become your own therapist, and that this relationship is going to end, because there's something very lucrative for the therapist about keeping your client in therapy, because you get paid, and you don't have to go out and do a lot of marketing of yourself. You just have these clients that you've been with for years after years. And I think the inertia not only happens with the client, Ari, but it happens with the therapist. The
I was going to say
therapist,
that as well. Yeah.
yeah,
Because it's
therapist just
familiarity,
gets
isn't it?
soft. Yeah, he's just, how does that make you feel? Hmm. Oh, I feel like this one. Okay, well, tell me about your mother. And these are jokes. How does it make you feel, or tell me about your mother? Those are kind of jokes, but they're jokes because that's the inertia. So,
yeah,
and
and
again, I love therapy. Therapy saved my life. Okay, I'm not dissing therapy at all, but I am saying that it can fail nice guys, because nice guys need more direction. Here's what therapy does. Okay, so therapy is, you have an issue. So you have this illness, depression, anxiety, something like that. And the therapist wants to go back and find out where the trauma is. Where was the breaking in your psyche that caused this illness to happen? And then we're going to go back and we're going to treat that trauma so that you don't have the intense feelings that you have today. And So you have to, the therapist is coming from an assumption that there's some trauma in your past that's causing you to have the feelings today, and you haven't been able to work through that trauma. So it's a little bit like chasing a ghost and trying to get this, move the ghost from over to the great beyond. And
It's
uh,
always about ghosts with you.
I know, I know.
You love the.
I love a good
I think
ghost
you.
story.
Yeah, I think you dated a few as well.
Yeah.
So, so
I'm always getting ghosted.
Chuck, you made a really good point about like going back in the past, and sometimes I believe that we also have like wiring and DNA and our system, our software, and we can't fix everything in our software as well. And then going back and trying to figure out every single thing, it might not just be everything in our childhood, but there might be some things in our blueprint, our own makeup of that. And I think this is where therapy can get really stuck, and it can really keep nice guys. And I believe that therapy, great, it's great to have that emotional connection. I had a client, and sometimes I can gauge when they've been overwhelmed. They need some connection time. They just need to vent and release that. And I've done sessions where I've said nothing for about 30 minutes, 45 minutes, and just let them speak, and they feel all relaxed. It's like having a sparkling water or something, and it's like you shaking it, pressure builds up, and then it's like it's ease. I also believe that therapy doesn't help nice guys because it doesn't initiate them.
Mhm.
And that's a big problem. It keeps them into boy psychology because we need initiation. We need to transcend from the boy to a man. And the only way we can do that is being pushed, challenged, pulled. And, challenge is the main one. And I believe that what therapy didn't do enough for me was challenge me and say, right, you need to
Mhm.
stop fucking about. You need to stop dicking about and get this sorted out. I needed that both push, like hard push, but also that love. And that's what I found that a lot of guys miss when they do therapy.
Mhm.
Yeah, I think when I look back on all the therapy I had, there wasn't a discussion about masculinity
Mhm.
and what it means to be a man. And I mean, and I had male therapists most of the time too. But I think that's what you're getting at is giving men a blueprint for a positive masculinity.
Yeah, and they gave more of the feminine narrative, and you hear this a lot. I see this on Facebook. I put a post up a few months ago, and it says, "Oh," and women were getting really angry at me because I was saying that men don't need vulnerability like 24 hours. Let him be vulnerable and he'll be fixed. That's not how we're gonna fix men. Men need guidance, support, modeling, and a path and a blueprint, and for them, strong men to help them take them there, guide them there. Just being vulnerable and talking about it will probably makes women feel really good, but it doesn't necessarily make men feel good in the long term. It might do in the short term, but for as a long term, it didn't make me feel good. And that's the same thing I experience with my clients as well. When they've been in therapy for a long time, they felt good in this short moment, but they still felt like there's something missing. There's something missing about me being a man, and I need something more. And instinctively, there was a deep hunger inside of. And when they were challenged and pushed, and they felt that, they felt more connected to themselves. And I think this is
Mhm.
what therapy can miss out on if the guy isn't trained about men, masculinity, and the nice guy syndrome.
Well, to kind of piggyback on that, Faisal. So if you take this model where you have the theory is there's a trauma. The trauma was caused by somebody. Let's go back and find the trauma. And then we'll say, oh, this trauma was caused by your mom. All right. Now let's be vulnerable around that trauma. And what happens there is then it drops you into the victim state. Right.
Mhm.
So the vulnerability piece of it, or vulnerability is good and healthy. Vulnerability that keeps you stuck in a victim state is not good and healthy. And when you get stuck in a victim state, that's where it's really lucrative for the therapist because you're continuously being a victim. And I think that's the feminized piece of it is that again, if you're looking at the masculine feminine energy, the lower feminine part, one of the symptoms in there is that victimization. So it keeps us stuck, and that's part of the problem with the nice guys is that they're in that lower quadrant of lower feminine. So they're passive aggressive, they're victimized, they get hurt easily. All of those symptoms that we've talked about before, that keeps you stuck in that lower feminine, which is why, again, great for the therapist, because the therapist just keeps charging money to your insurance company and to you. But the person never really learns to pull out of the victim state into the higher state of, and especially for guys, they don't learn how to get out of the lower feminine and up into the higher masculine. They just
Yeah.
can get stuck
Stay
down
there.
there.
Yeah. Did that happen to any of you guys? I mean, I experienced it after my divorce. When I was going through my divorce, it was shattering for me, and I remember having kind of like therapy, but I also loved the therapy or the attention that the women gave me, and it was a space for me just to sit there and just talk about my emotions. She was loving it, I was loving it, and we were just in this endless spiral of just talking about it, talking about it, talking about it. I remember when I got into a relationship, and my girlfriend at that time, and she was a little bit more hard kind of headed, and I used to love talking about my problems, and I've gone through a divorce, poor me, and look, I nearly lost the house, and my kids moved away, and she went, "Oh, poor you," and I just looked at her and thought, "What? Where's the sympathy? Where is the emotions there?" And she said, "Well, what are you going to do about it?" And
This was
and I
your
was just
therapist?
no, this is a girl I was dating.
Oh, a girl.
And she
Okay.
said, yeah, she was just saying, well, you just keep talking about it. And the problem is, she goes, but what are you going to do about it?
Mhm.
And that was a kick. And I was like, okay, I need to stop talking about it and now take action. She was like, boo hoo hoo. She goes, yeah, you're looking for sympathy and you're looking for all that connection and empathy. And she said, I'm not your mother.
That's
I'm not your
exactly
mother.
right.
Yeah, I'm
Yeah.
not your mother. I'm not your therapist. Yeah, you're a man. You're an
Hmm.
adult. And I completely hated it at that moment. I hated that. I got really butthurt. I got really sensitive about it. And that's exactly the reason why I needed to do the men's work. That's why I got a
Hmm.
coach, and he was very. I had some coaches who were very brutal, and they said we are going to be really brutal with you, because at some point you really need to pull yourself out of that. Poor Faisal, I've been
Hmm.
victimized and I'm done. And he goes, you need to really. And they said things that I was very sensitive to. Like, you need to man up. I was like, you can't say that. He goes, oh, what's the matter? Why do you find that difficult? So, and again, it was a great process to say, look, I'm going to throw everything at you, and it's about building that resilience. If I say man up, if I try to hit your frame, it's building that resilience so you can take that. And this is what therapy really takes away, robs men of that resilience part.
I had good fortune of having a really good male therapist, and um, he did talk a lot about masculinity with me, which is why I think part of my framework in doing therapy is highly um, influenced by the therapy that I had. And one of the things that he mentioned was that he went to, you know, his graduate work was at a university where essentially there was a high level of feminism, and he would, kind of get what's the word? He would kind of get like picked on a little bit because he was the only man in the classroom. Somebody was like, "Oh, well, what's the masculine perspective on this kind of thing?" And and it was almost like this shaming thing about being masculine. So I think there's an issue in the universities where the vast majority of therapists are women. The vast majority of teachers that teach other therapists how to be therapists are women. And the men that are in it are highly feminized because they just take on okay, this is how we're supposed to do therapy. And the result of it then is you're not getting a good perspective of the masculine. I mean, you go to university, I was talking with Ari about this. You go to university, you can get a doctorate degree in feminism. You can't get even an undergraduate degree in masculinism. Why is
Oh,
that?
that'd be so wrong. Yeah,
Yeah.
patriarchy,
but
masculinity.
but isn't
Um,
there supposed to be equality, right? I mean, that's the whole thing, right? You're like,
well, it's selective
it's
equality,
selective
right?
equality. But what I'm saying is that oftentimes, unless you find a really good therapist, you're going to be so as a nice guy, like I said, you're going to be influenced by that lower feminine, that victim state, which keeps you locked in therapy for years and years. Or you find, and I think the flip side of that is that a lot of coaches and a lot of men will go
Yeah.
see a coach before they'll go see a therapist, because a coach has a very sort of sports analysis analogy to it, right? So, oh, I'm going to go get coached. I had a football coach, so it's like I've always had a coach, so let's have a life coach. Whereas, and that's again big, huge generalizations. There's always exceptions to the rules, but I think that one of the things that you'll find more coaches, male coaches who have been trained by other male coaches, um, more than you'll
Suit
find,
better for the men.
yeah, than you'll
Yeah.
find women. Yeah, you know what
So
I'm saying.
Chuck, you it just reminded me of something because you were saying that in therapy that most of the students are female, the teachers are female, then you go in there, it's everything's female. So that means if you go to a couples therapist, right, that means that men are gonna be fucked.
Oh yeah,
I have yeah, I have guys who
That's a whole nother episode.
that's
it's a
a
whole
whole new
nother
topic, right?
episode.
But I
Yeah,
was that
let me tell
yeah.
you
So
what.
that's
Here's what marriage therapy is. You're in a room with
uh
two women that are pissed off at you.
and if you're with another guy, is another version of a female who's pissed off at
Yeah, yeah,
men.
yeah. But yeah, I think a lot of men go to couples therapy and they feel like, at least, I don't know. I know you guys have all been in couples therapy. I was in couples
Yeah.
therapy where it's like, okay, if we can just fix the man, then everything will be okay. If we can just
Right.
get you to be more of a feminine in your, that you're vulnerable and that you're all of these things. And I'm not saying those things are bad, but I am saying that it becomes sort of like the fixated idea. Marriage therapy, it isn't necessarily about creating balance in the relationship. It should be, but it oftentimes becomes easier for the therapist essentially to align with the woman who is saying, if I could just get him to change, then everything would be okay. And
It dresses. It's more about the feelings, right? It's more about addressing the feelings than actual the system behind it. It's more about
right.
how is that how you feel? Okay, that's not right.
Well, if you can understand her feelings, then you will see why she's being hurt and you'll stop hurting her. That's the idea, right? So the idea is to change the behavior, but we're saying that your behavior is wrong in the first place. Well, it's a two-way street. Both people need to look at their own behavior and how they contribute to and how they've co-created a relationship. So anyway,
One of the yeah,
obviously I have some
we
feelings.
I think
Yeah.
that deserves its own episode.
Right.
But Faisal was bringing up another point, and how his girlfriend
Mm.
reacted to him, about like you need to man up. Um, what you weren't getting from therapy was instruction in uh, what
Growing some balls.
most women are looking for in a relationship. In terms of understanding the masculine, feminine energies and polarity. So this is something that you're almost never going to get in conventional therapy, is an understanding of uh, polarity and what creates chemistry in a relationship,
Yeah. Yeah.
and what maintains it. Um, who's ever talked about chemistry with their therapist other than saying, "Oh, I think we have good chemistry," um, but the ingredients to it, it's never talked about.
No, it's not talked about that. And also, it was reminding me of when having been in a situation where my ex, she said to me, you need to man up, you need to be much tougher and stronger. And I remember that anything strong in those points used to really intimidate me. So strong independent women used to intimidate me, strong men used to intimidate me. I was really threatened and intimidated by this. And the good thing about coaching, the journey I've been on, I see a lot of guys who go through it. By the end of the journey, I mean, you're not 100% fixed. There's always going to be ongoing issues, but you get to a tipping point, and that tipping point is you're comfortable in your own skin, you're more confident. And I remember I met this woman not long ago, and she was really intimidating. She was really ballsy, and she said something that really threw me off my frame for a second. And had that not done the masculine work, I would have gone into a spiral, gone into my shell. But whereas I was able to, threw me off because I wasn't expecting it, then I regained my composure and came back, and I was able to hold myself. And this is the amazing transformation of doing the men's work, is you grow some fucking balls. That's the most beautiful thing about it. And women appreciate that. That's what women want, because they keep on saying, I want a real man. And that's what they mean, is a real man who's matured. He's initiated from boy to man, and he can handle himself.
So when we're talking about nice guys, that is generally what they need. They need that initiation. They need that blueprint.
Yeah. Didn't we all need that? I mean, didn't you guys feel like you needed that push and drive and that blueprint?
Mm-hmm.
Absolutely.
Yeah. I think it's been in many ways my life's work and life in drive, that I've always been seeking to learn more about the masculine, because again, like parents, God bless them, I didn't grow up feeling very masculine, and it was why I joined the military when I was 18 years old. Was I wanted to be around men, and I wanted to find out what masculinity was, and I wanted more discipline in my life, and that's been kind of a quest for myself, as to how do I get, I have this highly feminized side from growing up in a household with, fairly dominated by women and feminine energy. Now I want more of the masculine, and so my drive towards, even my, my thesis that I did was on male rites of passage, because I wanted to know more about masculinity, which, by the way, I almost got kicked out of grad school for being too assertive. So, yeah.
Yeah, we never talk about discipline in therapy.
No.
How dare you?
Yeah.
How dare you talk about anything that's the virtues of masculine and strength?
Mm-hmm.
And, we will need them when it's, when chaos hits. We need those providers, those protectors. But as you was talking there, Chuck, I was thinking about, how we men need other men
Mm-hmm.
to, iron sharpens iron, and how we can, learn through other men, through modeling through that. So if you're going to a therapist, and the therapist isn't talking about, hey, listen, we're going to do some discipline, routines, work out, do combat sport.
Right.
All you're going to go is get more feminine through osmosis, and that's going to keep you in your feminine, cultivate more of your feminine side. So again, I believe a good balance therapy is like salt. Too little, it's tasteless, and too much is unedible, and that's with therapy as well.
All right. So, what are the take homes for the listeners? What should they be looking for? What questions should they be asking themselves?
I think part of what you want to ask yourself, or what you want to look for in yourself, is, what am I actually looking for? And again, this is the basic question that we ask nice guys all the time, and they have a difficult time answering. So, like, what do you want? What is the transformation that you're looking for? Where are the points of your suffering? If you're depressed, go see a therapist. A lot of times I'll get guys who come in and want my coaching services, and it's clear that they're depressed or highly anxious or something along those lines. I'll send them to a therapist in their local area because I'm not going to treat you from a therapist perspective when you're outside of my licensing. But with coaching, it's forward thinking. It's those, and so if you want more masculine energy in your life, what I would say is go find a coach. If you are looking for something that's trying to treat symptoms of depression, anxiety, systemic, anxiousness, all of those kind of things, then yeah, go see a therapist. And a therapist can be extremely helpful in those areas. But if you want more masculine energy, that's where I would say go see a nice guy coach.
Yeah, yeah. I love that as well. And my tip would be, find somebody, what you want to achieve, find somebody who's already achieved that or who's doing that really well. And then find someone of excellence. So, for example, I teach about, I help single nice guys, be more charismatic, be more confident with women on dates and after. And it's one of those things that I've been through the experience. I've got the evidence of that. So find somebody who has already achieved something in your area that you want to really excel at, master is. It might be you want to master your, fitness or fitness. So find somebody, a personal trainer who's really good at that. If you want to master more of if you're married and you want to improve your relationship, find somebody, a coach who specializes in that. If you're single, come and see me. Right? But find somebody who is a specialist who've also done that path, walked the path.
Mm-hmm.
I really like that. I think one of the take homes is if you're looking for help, period, you want to get clear on what you need or what you want. And even doing that is growth. And so, you want to interview the prospective providers, whether they're therapists or coaches, figure out, do I really need a man's perspective? And I think if you're a nice guy, that's critical. That this type of journey through the nice guy syndrome, I think requires other men. So I think that's part of it. But especially as you listen to this episode, think about, does this sound good, what we're describing? And if you've had therapy before, maybe this clarifies to you what might be missing in terms of breaking through some of your nice guy patterns. Mm-hmm. So do your homework, do your research, and consider whether you need some of these masculine, the masculine blueprint that we're talking about. So thanks, everybody. This has been a good talk, and we'll get into more next time.
Okay. Thanks, guys.
Take care, guys.
You've been listening to The Nice Guy Show, the podcast that helps nice guys move past their insecurities and fears into the fullness of their masculine strength and confidence. Be sure to like and subscribe to our podcast and check out the website niceguyshow.com for more information on how to connect with Chuck and Faisal. Until next time, keep living your best life.